All right, everyone, we're going to go ahead and get started. This is Suzanne Elliott with Envision Consulting. And I am joined by my colleagues in California, Matt Kamen and Allison Fuller. So we're doing this webinar remotely as we are all learning how to work remotely. Matt and Allison, I'm going to ask you to, Matt and Allison, could you just say hi, introduce yourselves, which will also give us the chance to make sure everyone can hear you too.
Sure. Hi, everybody. Actually, when we were talking about this conference, we wanted to actually start off like on a happy note. So I just want everybody to know that in our office, we were thinking, hey, we should play like a song by Ariana Grande or just something to make us start on a positive note. I will tell you that we wanted to do this today because we wanted to bring people together because we all are going through this right now in real time, and it's scary, extraordinarily scary. And so we wanted to be the best resource we could for the sector. And I just want to be really clear on this one. This is just our first of many town halls like this. This is not going to be our last because I think every day things are changing. And so what we're going to talk about today is information that we've collected. But just know that we are not lawyers. So this is all the information that we've been able to find so far. And as things change, we'll continue to do this.
Hi, this is Allison Fuller, and thank you very much for joining us. Just echoing what Matt and Suzanne said, we've been thinking about how we could help, and in this way, think of us more as conveners and collaborators to help share our best practices with each other, because it's really kind of scary. The situation is fluid and moving by the hour, so we're definitely not pretending to be the experts here. We're all trying to figure out work and homeschooling for some of you and, caring for your family. So we're just going to try to be brief and help you as much as possible. Also, just know we'll be sharing the slides, the notes, and all the resources after our call today. So, to the extent that you don't have to take that many notes because except for the conversations that you bring up, we already have everything lined up.
Right.
Thanks, Suzanne.
Great. And thanks everybody for sharing your name and organization in the chat feature. We're also going to share a list of everyone who is on today's call. If you don't want your name shared, you can just let us know. We do have organizations from California, both LA and San Francisco, and some Ventura County as well. We also have some folks from New York on the line too. So the information we're going to be sharing is mainly California, but we also are sharing a bit for New York as well, knowing we have some of us East Coasters on the line too. So we have 1 hour together today. And what we want to focus on are like the most pressing issues and questions that we're hearing from nonprofits and that we're all experiencing. So we divided today into 3 sections, 3 big topics, and then a few subtopics: employees, income, and programs. So for each section, we're going to have about 15 minutes. And what we're going to do is start off with Matt, Allison, and I are going to share just what we're hearing in terms of trends, news, resources, questions, and then turn it over to you for questions or just ideas, comments, anything you want to share on these topics. So for each of those sections. And we're going to save 10 to 15 minutes at the end for just other open-ended questions, thoughts that you have, and resources. Everybody on the line, as I'm sure you can already tell, is muted, except Matt and Allison and I. And then what we'll do when we get to the point in each section where we're opening for questions is you can either use the raise hand feature on Zoom, or if you're not familiar with that, you can just use the chat feature and just say, I have a question, or even share your question. And I will unmute you so you can talk. So that's what we're gonna do housekeeping wise. So let's dive in. Employees. So safety and well-being employees. Yeah, I think for all of us, that's been first and foremost in our minds for weeks now and continues to be. And hopefully you've already been focused on those basics of the hand washing and disinfecting workspaces and so on. If you need any refreshers, the CDC's guidance and OSHA guidance that's specific to your field is great. And we will, of course, include that in the resources that we send out. And then there's just kind of, I think everyone is discovering day by day additional things like, you know, maybe even having thermometers in your office for people who start to feel sick at work or wherever they happen to be working, and can quickly check to see if they have a fever. Now, some of those things that are just starting to come up as we continue to live through this. If you're still operating in an office or a facility, you're also, you know, all of the new requirements around distancing between people is taking effect. Most offices we're talking to in facilities don't have full staffing now. So one of the things we're telling clients to be careful about is to make sure that in-person responsibilities that are really key, like security, facilities management, make sure you have that handoff between staff as you're kind of, you know, going between who's there and who's not. Something else that we're hearing more and more is, you know, we're all this, as each day goes by, this is becoming more and more stressful on everyone. We're hearing a lot of people, including ourselves, you know, everyone's kind of starting to think that they have this, whether you do or you don't. And whether it happens at work or at home, we have heard from some employers just to be mindful of not putting too many requirements on your employees to return to work. For example, if someone's not feeling well, we've seen guidance to like not require a negative COVID-19 test for someone to return to work because testing is simply not available. But you know, to get tested for the regular flu first if you're not feeling well. So some tips like that are starting to come out. If your employees are in the community, so outside your facility, if they're somewhere in the community, home-based, other nonprofits, of course, there's a whole other level of safety checks you're going to want to be doing. We've heard some agencies talking about instituting screening questions about health before doing home visits, even adding daily check-ins with on-site nonprofit partners, just to be sure that you're putting employees, you know, to the extent that you can manage it and manage the risk, you know the situation before you put your employees out into the community or into other facilities each day. So the other piece of this that of course is huge and is really changing day by day is PTO, sick leave, disability, and you know, it is at this point, California and New York are kind of every day is shifting a little bit in terms of what the situation is. But in California, short-term disability will cover those who have the virus or have been certified as exposed to it, and that 1 week waiting period has been waived. Caregivers who are taking care of someone who's ill or quarantined are also covered by family leave. In New York, it just, you know, shifted a little bit yesterday and is a bit more complex, but it varies by the size of employer. But it's coverage, it's somewhere between 14 paid sick days for large employers to family leave for the full duration of the quarantine order for smaller employees. For all of these situations, employees are encouraged to take their PTO first before going into disability. In California, another piece of it is that if employees have to miss work to take care of children because of a school closure, they can file for unemployment if they have no other childcare options and they can't work remotely. Haven't seen anything like that in New York yet, but that might change. And then another piece we want to share here is obviously also, you know, paramount for all of us is just mental health concerns, family concerns. Everyone's juggling so much. It's such a time of high stress. Employee communications is just more important than ever before. Staying in touch over email, phone, text, whatever works, you know, for your employees. Your employee assistance program or other mental health benefits that you have, make sure you know what they are and really encourage staff to take advantage of them. You know, encouraging, you know, to the extent possible, exercise, meditation, taking care of ourselves. Caregiving is also a huge concern for many people right now, whether it's taking care of children at home from school, supporting older family members. as employers, just flexibility is really paramount right now, as well as, helping to, potentially think about some creative, safe ways of helping employees out right now, informally, formally. In New York City, just yesterday, a number of human services workers are classified as essential, which means that they'll have access to city-sponsored childcare, which is going to be very helpful for a number of providers in New York City. I haven't seen anything like that in LA or in California yet, but that might be coming, so something to watch out for. In general, we were going to mention that, there has been specific guidance for human services providers, at the city and county level, and we will send out some websites that have consolidated lists of that guidance. I'm going to turn it over to Allison to talk a bit about remote work now.
Hey guys, so this is moving really quickly. I think last week, Monday, I turned to some of my coworkers and said, do you think they'll close schools? And we said, nah. And then they said, oh, you think they might close other things? And crickets on Monday. So this is a very quick moving situation. So remote work works differently for every organization. Obviously, some of you have center-based services. Some of you have home-based, which I think is even more challenging services. I don't know that you have a whole lot of options there. But, we get different calls from different organizations trying to flesh out what that remote work looks like. Now, here's an area where we do really well as consultants because we do a lot of remote work. Actually, not me. I like to be in the office, but a lot of people do in our specific line of work do remote work. So I had a friend call me yesterday and say, all my employees are begging me to work from home. And he works at the Kaiser Hospital. So obviously not feasible there. Sorry, they're going to have to work from the office. But I think that's the first test. Is it feasible? Not just in terms of the work that you do, but in terms of the equipment that you have, the policies that you have in place, the contracts that you have. Some contracts simply don't allow for telework. So really, when you're considering this, which I know many of you already have, it first and foremost is what's feasible and what's not. Second of all is what's your policy? Do you have a telecommuting policy? By the way, most of us don't because we didn't plan for a pandemic. We're pretty good at planning, but pandemics weren't part of our policy. So even we're putting together here at Envision, we're putting together one for ourselves, and we're happy to share that with you as a template for your employees. And that's going to cover things like expectations, communications, what's your response policy, what equipment are they taking home, and do you know how much equipment you have? That's really key. If somebody's borrowing a computer or needs their cell phone reimbursed, or you're starting to have to pay their internet at home, are we covered in all of that? And are we making sure that we're clear with our employees about what their expectations are and what they can expect from us? The next thing is technology. So here are some tips I'm going to give you about how we communicate in our office, mostly operating remote. So we have about between 10 and 12 on our calls every day. So we start every day with a stand-up meeting. It's called stand up because you're not supposed to have enough time to sit down. So you stand up and just say, hey, this is Allison. Today I have a webinar to present. I also have a board meeting this evening, and I have to finish up the narrative on the strategic plan. And then Matt can chime in with what he has to do for the day. We recommend groups of no more than 15. So it can be by department, it can be by supervisor. It seems really arduous, but it's a good opportunity to really let each other know where you are, check in, see where you can help. You can also tell very quickly if somebody's running out of work and reallocate work as it goes along. Also, for those employers that are going, our employees at home, how do we know that they're productive? That's one way. Technology that we also use, we use a product called Monday.com, just like the day of the week, Monday. And it helps us track projects across multiple different lines of business at the same time. It's a great tool. It is very, very easy to set up. It looks just like Excel, except it's color coded, and it has a lot of charts about productivity. If you don't do a functional timesheet, there is technology to do that as well. So the option that we use here in our office is Harvest, and Harvest allows our employees day by day to bill and log their hours. It seems arduous, but it really gives you a great picture of what people are working on every day. It helps them to manage their time a little bit better. And it also imports your calendar. So if you're using a Google or an Outlook calendar, you can import that into Harvest, and it will, as you set it up, start to populate that for you. If you need a referral to a great consultant who can help you set that up, we're happy to give you that referral. We use technology, but we're just learning. So maybe we're not the best to help you set that up. And then lastly is just communications. Being really clear with your employees about communications, what their communications should look like in between. So set up a sanctioned way of communicating, whether that's Slack, whether it's Google Hangouts, which is free, whether it's any of your employee intranet. Set up that policy for communications and allow those centralized communications to come through. One thing about this is I had a different client who had told us yesterday that their employees were concerned that basically Orange County had called martial law, and that rumors started to circulate very quickly through the employees. When the bill was actually read, it's not, but it was too late by then, and the employees had already panicked enough to demand that the center be shut down. So try to stay on top of these communications as fast as you can, and read the bills that are coming through. I know they're 164 pages each, but you really want to be on top of it so that when somebody says, I heard that they're going to call martial law on Monday, you can send out an article proving that no, that's not going to happen, at least not yet. So so I'll move on to Matt so he could talk about the fun topic of workforce reductions.
I will be honest with everybody, this is probably the hardest thing that we're going to talk about, and hopefully, those of you who know me know that I'm pretty, stable and kind of can keep my shit together. But honestly, yesterday I broke down 3 times figuring this out. So I'm just going to be honest with you. This is the hardest piece, and this is what we're dealing with as well, as are you. And to be honest, this was a really big reason too why we wanted to do this webinar today, because we're all dealing with this. We're all dealing with looking at cash flow, and a huge part of a budget and cash flow is staff and the staff line item. So what I will tell you is that Allison and I sat down yesterday 3 different times looking at our cash flow and our budgeting, and we looked at all of our options for staff. And so from what I can tell you, here are the different things that you can think about. First of all, you want to prioritize. That's the most important thing you can do, is just prioritize what you need now and what you don't. And I would say probably just, when you're looking at your cash flow, and really sit down, if you have a finance person, make it honest, and then also worst case scenario. That's what we did.
Right.
And thinking about, okay, how much money in the bank do we need? I've talked to so many different people, and people are saying that you need 3 months to 6 months in the bank. But what happens if you only have 2 weeks in the bank? These are scary things. So some of the things you can look at is, if you have a line of credit, now is the time to take it. If you have bills lining up, only pay the ones that you have to, like pay the minimum on your credit card. I have to believe they're not going to shut the electricity off. So, certain bills you can actually just, I hate to say it, but just don't pay it. In terms of loans, you can look at the SBA loan. There is a stimulus package coming out. We don't know what that's going to look like, but hopefully that will be figured out soon. In LA, Mayor Garcetti is putting together a fund that hopefully folks can give to, and then we could apply for it, or nonprofits could apply for it. I'd also tell you to really lean on your board at this point. Like, really lean on your board. It is lonely to be the executive director. Right now, it is shit to be the executive director. And so I will tell you that leaning on your friends, leaning on your board, is really important. And also looking at the other resources out there, the California Community Foundation, Nonprofit Finance Fund, these are all places you can look at. But I do want to talk a little bit about staff. And there are three things you can look at. You can look at furlough, you can look at work sharing, and then a straight layoff. Work sharing is pretty cool. What you can do there is it allows up to 60% payroll reduction and 60% hours reduction. It is through the EDD. Take a look. It's a little bit arduous because you have to fill out paperwork hourly per employee that you do it to every week. And the thing to keep in mind about it is that if somebody goes out on sick time, they're still your employee and you still have to pay that sick time. But it is something to think about that I think will help employees because they can still be employed even if it's for minimal hours. And the EDD will cover the majority of what they're losing. We've also talked about furloughs. The nice thing about a furlough is what you're telling your staff is, we can't afford to pay you right now, but as soon as things turn around, we're going to bring you back, right? As soon as we can. So it's a nice way to basically lay somebody off. I tell you immediately to talk to your insurance company. I'm trying to think if there's anything else that I wanted to share with you. Just honestly look at your forecasting and lean on your board. Be honest with your staff. We called every single one of our employees yesterday and we had this conversation. Because we're all doing this in real time and we don't have all the answers, we were really honest with our team yesterday. And that was really hard, but I will tell you that everybody knows what's going on and everybody understands what's going on. And then right now, by the way, our staff is on this call. So they're hearing everything that I'm saying as well. Yeah, so my hope is that things will get better. Things will get better. They will turn around. Hopefully this is just, 2, 3, 4 months. But when you're really thinking about staff, all I would tell you is be honest, rely on them too, and look at those 3 different options for laying off staff if you have to. Something I missed?
So let's, I'm going to open it up now. If anyone has a question or a need related to employees that's feeling very pressing for you that you'd like to ask us about or ask the group, now's the time. So you can use the raise hand or just enter your question in the group chat. Has anyone seen any other suggestions that you've seen or heard about this week for creative ways of kind of managing the remote work and, sometimes having employees that are still in an office or in a facility, as well as some who are also working remotely? I know that's another question that we've had this week.
Does anybody have any other tips for remote work or is finding challenge moving your employees to remote work? Oh, yeah, fundraising question. I think is that our next slide?
Yeah, we're going to go into, we can move into income. Our next section is on income. So Christina, we'll talk about that in just a second. Christina is asking about asking donors for money during this time and possibly sending special appeals and how to manage that. So we can move into the income section then. And if anyone has a question about employees, we can certainly come back to that. So income, we're going to talk a bit about events first, then fee-for-service reimbursement, and then kind of generally fundraising at the end and take questions. So events, I think for a lot of nonprofits, this was the first big change that just hit everyone, especially if you had a gala or some other big events in March or April. Most organizations are canceling or rescheduling their fundraising events. April events canceled. I'd say at this point, I'm hearing all May events for the most part are canceled as well. June is starting to seem questionable. From what we're hearing and from Cal Nonprofits guidance that came out the other day, it doesn't really seem to matter that much if you have event insurance because pandemics are excluded. So some organizations we're hearing from have been able to secure partial refunds from venues or other vendors. Some have been able to get a credit for a future event. Some are still negotiating. You're going to have to kind of negotiate to see what you can get. If events are rescheduling instead of just straight up canceling and moving on, most seem to be aiming for the fall. And we say that as kind of a like yellow flag for everyone to think about, because that's assuming if things do get up and moving again in the fall, and we can all have events, it's going to be a very crowded season. So if you're thinking about rescheduling an event, if you already have sponsors, if you've already sold tickets, if you already have auction items, maybe try to salvage it and reimagine it as a virtual event, or like half in person in the fall, half virtual maybe now, or this summer with an online auction, maybe some kind of streaming virtual program, social media engagement. If you don't have that much sponsorship money in or tickets sold or auction items in yet for your event, or your event is maybe this summer, maybe think about just kind of cutting your losses and letting the event go and just focusing on individual giving and maybe sponsorships this year. It's not impossible to turn events from in-person experiences to something different, the kind of like non-event that sometimes people have, but it is challenging. So we are telling people to think about potentially cutting the losses on the events and just focusing on other fundraising. We also, certainly there are lots of us that have program related events, whether they're conferences or advocacy days. We've talked to some organizations with youth summits coming up. It seems like anything from now, at least through June, is going to need to be canceled or rescheduled. And certainly if it's a large event or any kind of vulnerable population, it certainly seems like through the fall, you need to plan accordingly. A lot of events or elements of events are trying to move online, which is a great opportunity. If you're working with a population that has that access to technology, you can set it up. You'll be able to manage it. It's a great way of keeping people engaged and keeping some programming going as well. And then there's all the technology pieces that Allison kind of alluded to earlier with that. So I'm going to turn it back over to Allison to talk about fee for service, because we know this is a really, really pressing question especially for human services providers.
Yeah, so on the fee for service, just 1 second though, if you haven't looked at the chat, some really great approaches from Regina about how she's dealing with working remotely, rotating different staff on different days so that you have more space, and also everything isn't overburdened. So that's a great policy. Also, Kelly still in the office, but starting to talk about how you're going to share tasks list. Google is a great, no cost in most cases, solution to almost everything that you want to do, from meetings to chat to project management. So thanks for sharing that. Fee for service reimbursement. So the Cal nonprofits and the New York Council on Nonprofits and other state advocacy groups, they're working to pressure state and local government to continue to pay on grants and contracts, even if deliverables are not met. So due to a suspension of services or site closures, as of today, we don't have any official changes in New York or California, although we've heard from some alternate guidance in San Francisco. So just a few things on that though. We do know that there's been a directive from DDS to pay for some visits that were canceled due to coronavirus. So DDS, Department of Developmental Services here in California. We know as part of the stimulus, so if you didn't read the 2 bills that Trump put forward on Friday that extend Medi-Cal, Medicaid waivers for services, that allow expansion of services in HHS, that drop some of the requirements around starting services or expanding services. I'm going to include those rather lengthy bills to you, and I know there's more on the way. So there was some expansion of services under both of those directives, so we'll be including that as well. So they're definitely worth your time in reading. If you can support the advocacy groups in your if you can support your advocacy groups in signing those petitions. Also, if you have relationships with your city council, with your local representatives, we need to be heard at this time. They need to understand that we can't provide services without staff. These are critical services already impacting the most vulnerable populations. So this isn't about staying home and watching Netflix for a lot of the people that we serve. This is the difference between having a livelihood and not having a livelihood, between having food and not having food. And so it really needs to be made clear that the people that are being most impacted by you having to cut services, or you having to shut your doors, or you having to furlough workers, is not as it is your workers, but it's really our clients. So make sure that you're making that point to your local representative. And what we're hearing from our clients is dramatic. So as Matt shared for you yesterday, we we called our own attorneys and accountants, and we were the only ones at that point calling not to close down our services. So many organizations, as of yesterday, have shut down sites, have stopped service delivery, have put half their staff on furlough, and these are from small organizations to large organizations. The impact isn't reflected yet, but it'll be reflected in 2 weeks when new unemployment numbers are filed. So it's really important that we get ahead of it and start. There's going to be a lot of constituencies who are looking for changes in their contracts, but to call your contractors, to call your vendors, and your representatives, and really help them understand that when these fees are built on service provision, it makes it really hard when you don't have employees to provide that service. So just a note on service provision. Okay, so Matt and Valerie from our team, I'm going to hand that over for fundraising because I see a lot of questions about fundraising.
Sorry, we're trying to keep our 6 feet distance too, so Allison and I have to like walk around each other. So I just wanted to share one thing about foundations. So we are connected to a ton of foundations in LA, and they are all trying to figure out what to do. So just know that they're also having these conversations. So one thing to keep in mind, which I'm not trying to kind of be negative about, but their stock market is dropping, and that means that their funds are dropping. And also, as you know, we can't just rely on foundations because pretty much every nonprofit is going to all the foundations, all the major foundations for this. So, you know, just keep that in mind. But there is some good news. I'm going to give you some good news. So I've talked to a few of my friends, and basically what they believe is that, first of all, every foundation, or the majority of the foundation, will let you convert your restricted funds to operations. So I would just reach out, make sure that's okay, especially because we do have a ton of restricted funds out there. They will let you, most likely, move it to general operating. And like I said, I just reach out to them and make sure that that's the case. They will also extend grant deadlines, stretch out final reports, even a year out. So, you know, they're not worried about paperwork right now. They're more worried about you guys staying open. And I think what they learned in 2008 is that they need to step up. The things to know is that CCF, California Community Foundation, has started a rapid response fund. Foundations will also start pooling their funding to help support those funds. The California Endowment's done a lot. I've seen a lot of emails to their staff, and they've already committed millions of dollars for special funds. And funders are also accelerating payments. So if you're on some kind of payment plan, just ask them to pay you now. You know, you have to be honest with them. Funders want to help. They really do want to help, but they don't have endless resources. And unfortunately, like I said, because of the stock market, it is going to be more and more limited. So just be honest with them. See if they would do that. I am pretty sure that the majority of foundations will be doing all of those things. So that is a positive. Yeah, that's what I got for foundations. I'm going to move 6 feet away from Valerie, and then she's going to come into fundraising.
So I would like to address Christina's question in terms about having an appeal right now. So communications is essential right now. I know we're all kind of following the news and following Facebook and probably going crazy. And the people we actually want to hear from are our nonprofits that we support. This is a time when your donors want to hear from you. This is a time to be cultivating them. This is a time to manage those relationships so that when the world does turn around and we're all raking in millions, you know, they're still there and they still remember you. So in terms of an appeal, I mean, you have to decide two things. Are you in crisis mode or are you in continuation mode? Because those are two different things. Are you on the front lines of the coronavirus? Do not ignore the coronavirus. Do not send out your typical annual spring appeal letter. You have to hit this right on. How are you being impacted? So if I put myself in the position of being a donor, I want to know four things. I want to know and be as clear and transparent as possible. I want to know, how are your people? How are the people that you are serving being impacted by this specifically? I want to know about your staff. Are they still employed? Are you taking care of them? 2, I want to know about your programs. What programs are continuing? What programs are on hold? And what programs did you all of a sudden have to completely rethink and how you're being innovative? 3, I want to know what I can do to help. Can I drop off the extra toilet paper that I overbought? Can I make calls to politicians? There is something to be done, and it will help me feel better about my situation because we are all in this together. This is a community. And then I had another one. Oh, I know. I also want to know that I have been supporting you for a long time and that you are stronger because of that you have cash reserves because of me, and you're going to be okay. Now I think we can probably open it up for conversations.
So I see Christina asked about virtual events. So some of the things we've seen that can work, I mean, virtual events aren't necessarily a slam dunk. You have to have an audience that's going to participate in a virtual event. But if you do think you have people who, you know, can get online, are willing to donate online, it is an approach, especially to salvage one of these spring events that you already are invested in. Online auctions have a lot of potential because the technology is there and you can, you know, just kind of move things online. The only caveat now is if you have an auction that has a lot of in-person experiences that can't be used right now, it's not going to be that effective. So, you know, can you get some virtual experiences? One of the ideas I gave to a client last week, which you can all steal, is, you know, if you have any celebrity connections or minor celebrity connections and somebody be willing to like do a Zoom call, auctioning that off, that would be kind of a cool online auction item. If you don't have auctions, you know, you can ask, you can kind of say we're doing a non-event and just ask for straight up donations. Honestly, I don't know how effective that's going to be in this climate because I think a lot of orgs will be trying that. But if your event is imminent, like it's an April event, even an early May event, I mean, it might be worth trying because you have the event branding already and you probably have already been doing marketing for the event. I don't, Valerie or anyone else have any other suggestions for how to make a virtual event work for fundraising?
Yes, we have a client who had a donor cultivation event planned in a week or two. So they actually decided to postpone it and are kind of putting together a webinar, which is going to be like 50% who we are and 50% how we are dealing with this crisis and our population. And that's a really interesting twist on things because, you know, it kind of gets you out of your head, but at the same time, it's learning. So this is a new idea. We'll see what happens when they get to it.
And then one thing I wanted to just say, I just literally got an email from a friend of mine that the Hispanics in Philanthropy Foundation right now is creating a fund. It's not a huge amount of money, but still it's money. It's $200,000 for mini grants to help those nonprofits who are on the front line. And I don't think that's going to be the last. So I think a lot of the foundations out there are going to create these funds. So just as best you can, keep up with that. We will, as anytime that we know this, we'll put it on our social media. So I would tell you, if you haven't already, follow us on social media so we can share whatever information we have in terms of what's happening for the foundation world. It's really important.
And also, and actually Melanie from Jericho Road mentioned this in the chat too. Candid is doing they're doing a pretty good job, I think, so far of tracking some of these COVID-19 specific funds and grants and emergency funds that have been set up. So we have a link to that in our resources that we'll give you. A lot of them are regional, and so many are through community foundations, but hopefully there'll be lots more of them, and hopefully Candid will keep those up to date, so you'll have one place to kind of go and see what the options are. And thanks for everyone, by the way, sharing all of your tips in this chat. We're gonna pull all of those suggestions out. Celine, thanks for all the remote working suggestions. We'll pull all these out and put them into the notes so everyone can see them and have them. Before we move on to our final section, which is around programs, any other questions or comments around income? Okay, we're gonna move on in the interest of time. Programs, which arguably could have been the first section. Any of these could have been. So basically we're hearing from nonprofits, increased need, scaling back, and then changing delivery of services. And for many organizations, it's all of the above that are happening all at once. So increasing need, obviously there are many of you are just seeing a big increase in need in your communities with the populations you serve. Our piece of advice here, we are all givers. You are all just generous and giving and committed to your mission. Before you dive into addressing kind of that increased demand in a big way, take a breath and just make sure you have the resources to meet that demand on your own. The need's huge, but you have to do a quick feasibility check. If you say no, we can't take this on, see if could you set some parameters and maybe take on a piece of it, or even better, could you find a partner, another nonprofit that you could collaborate with? We just think it's really important, because if you say yes too much and too quickly, you could end up in a very short period of time having to cut back on the services your core services. There's a small nonprofit in my community that incurred huge expenses in just 2 days last week, and now they're really struggling for cash. And not that I'm telling them they should have said no last week, but I wish they would have found a partner or some other way of making it happen. We really think that nonprofits that are going to survive and thrive going forward are going to embrace collaboration like we never have before. So whether it's programs, funding, operations, looking at ways you can start some of these informal collaborations now, so important. And maybe they become formal collaborations down the line, but just informally starting to work together now is going to help on many fronts, but particularly in addressing this increased need. We can't do it alone. None of our organizations can. Our other tip on this piece is, before you take on more in terms of more services, different populations you're serving, different facilities, talk to your insurance broker. And sorry, I did not change the slide. Sorry, everybody. Talk to your insurance broker, make sure you're covered. I mean, especially given the new health risks, you just want to make sure if you say yes to something new, you're covered and you don't end up taking on too much risk. So then kind of the flip side of the coin is scaling back. There are a lot of programs, a lot of organizations that just can't operate right now, separate from my financial concerns. There's school-based programs, and most schools are not open right now. There's senior centers that aren't allowing in visitors for health concerns. You want to try to the extent possible to assess if the scaling back is temporary. So your programs, for instance, will be able to start again when schools open, or when larger gatherings are safe, or if this is something that it feels like it's going to be more permanent for you in terms of scaling back. If it's hopefully a short time period, and there seems like there would be kind of an end to your scaling back, and you'll be able to get back to some sort of business as usual, use this downtime wisely. Hopefully you won't have to cut back on staffing, or you can find some alternatives like Matt talked about earlier. So plan now, train your team, fundraise, get your communications sharp, talk to your donors, partner with other nonprofits. Maybe you can be the helping hand to up another nonprofit that is seeing an increased demand and you can help in some way? Are there temporary ways that you can serve, still be mission focused, but keep moving forward, even if you can't continue right now providing your typical services and programs? Then the third bucket is changing programs or changing program delivery. And I mean, we've seen so many examples of this over the past week or so. Mental health services moving to telehealth because some HIPAA regulations have been relaxed and technology is catching up a little bit to allow that to happen. We've heard about childcare centers that are shifting to support the children of first responders and healthcare workers. We've been hearing about case managers who are shifting to phone and video appointments, spacing out of appointments. We've heard about different ways of engaging volunteers, maybe trying to move to virtual volunteer opportunities where it's possible, or engaging volunteers for things like delivering meals, to doors for those who can't get out. Or sometimes that we've heard about some organizations that have been volunteer driven in their programs, and because volunteers are not able to leave their houses and be out and about, they've had to shift to more staff delivered programs. We could keep going on with all of these examples, and to me, it highlights this sector and how nimble and creative you all are. We're gonna have to keep being nimble and creative for the foreseeable future, which is amazing, but that takes resources. Back to Matt's point, go to your funders, go to your donors, and tell them this is how we're shifting and how we're addressing the need and the changing environment. We need money, we need people, we need, what do you need to be able to make that happen? And look for the partnerships too, that it can help you. So those are some of the things we're hearing around program shifting. I'm looking to see the questions that we had. Let's see, before we go back to fundraising, are there program specific questions or ideas that anyone wants to share or ask? Matt and Allison, is there anything else you're hearing in terms of program shifts that we should share?
Not really at this point. We're just seeing scales back. I think to an extent, we're all just kind of reeling from the intensity and timing of this change. So at this point, I think most organizations are really just looking at scaling back services. But they're all working on new program delivery modes. So as we get enough of them who move into that, we'll be able to share that information.
Christina, I see your question about the Hispanics in Philanthropy grant. We don't have all the details in front of us right now. It'll be on the list of resources that we send out so you can take a look at it.
It does appear, though, that it's only available to existing grantees. That is our first reading of it.
Okay, great.
But everybody, please call your funders, your existing funders, your grants that are in process, your donors that you have. I think one of the underlying things that we want to emphasize here is, although communications was not its own topic, it is the critical topic. Reaching out to your funders, reaching out to your contracts, reaching out to your local representatives. Hey, your board is always saying, how can we help? Here's how they can help. They can help you on these communications to all of these different constituencies. Here's where we are. Here's what we need from you. And here's how we can move forward. And give all those board members an opportunity to help out the way that they say that they would always like to, and have them make those calls. Have them reach out to their free pro bono services attorney, their accountant, all of their advisors that they have. I think we'd all like something to do at this point to feel a little bit more in control. So the key to this is really to mobilize all of the people that you can, be it staff or board, to communicate, to reach out. We're all a little bit in shock. You don't have to pretend to have all the answers, but the answers that you do have, the more that you share, the better position that you're going to be in.
So we're going to move on here and just, we won't go through each of these, but we have some resources here on these slides, which we're going to send out. We have additional resources we're going to add to this list and we'll send out as a follow-up to today. I mentioned that, so this is, this page are a couple of human services providers, one's New York and one's LA County, that are just a good compilation in all the research I've done the past couple days. These seem to be two of the best, just one stop for human services providers on the latest guidance, on just links to all the information you need and the latest just changes that are happening. So recommend those. And then, oh, sorry. Okay, Candid, I mentioned that this is the old Foundation Center, by the way, they've changed their name. They've been doing a good job staying on top of the latest COVID-19 specific funds and grants and RFPs, so check them out. Nonprofit Finance Fund, Melanie, I know you mentioned they have some funding as well. They have, this link is like just a really great cash flow tool and financial scenario template that is useful anytime, but really important now. TechSoup, always a great resource for us, but they have links to a lot of kind of the latest remote working and a productivity software, including a virtual workshop they did on how to do remote work. And just as an aside, a lot of Microsoft Teams, Zoom, obviously, a lot of them have made their premium products free for 3 to 6 months just this week. A lot of that was announced, which is fantastic and will certainly help with all of our remote work and remote programs and everything else we're doing. The one thing to keep in mind is if it's something new you haven't used before, we've been hearing that the tech support lines for all these places are just jammed because everyone's flooding them. So if you have a board member, if you have a volunteer who's savvy with some of this software and some of these programs and you can leverage them now, definitely do that because you might not get all of the support you typically want to get from the official tech support. I want to mention the Alliance for Strong Families and Communities. Some of you might be members. They have had some great webinars in the past week, specifically on COVID-19. I participated in one yesterday that was really fantastic. And they're doing one on HR tomorrow that also looks really good. Only caveat is they have resources posted that are fantastic, but they're only for members. But the webinars are open to non-members, and they're free. So those webinars have been great. Lawyers Alliance of New York, some of their legal advice is New York specific, but they have some really great resources. They especially put something out the other day about contract considerations that is not New York specific, and I think can be really helpful. Bridgespan, always a great resource. They have a 8 steps for managing through tough times that we think is really helpful. So those are just some of them. We'll have more when we distribute all of our materials after the call, but I want to save our last 5 minutes here for other questions, other comments, other ideas that you have today, as well as anything else that you would like to see from us that would be helpful going forward in this kind of webinar kind of format or anything else. So opening it up for other questions, comments, or just needs that you want to share. Team in California, do you have anything over there?
Nope, just thanks for joining us. If there's information that you want to share. Oh, sorry. I think I cut someone off. Okay, thank you so much for joining us. We may have a second one, so just keep in touch. And we'll be sending out the slides and all the resources. So I hope that this is the start of the way up for all of us. Thanks so much for joining us.
Take care, everyone.